Welcome to Aging Gracefully on Suncoast FYI. I'm your host, Nancy O'Neill. Each week I speak with local professionals on a wide range of topics, from fitness to finances and from dance to dentistry. We are here to give you tips and advice on how you can live a happy and healthier life no matter what age you may be. If you're thinking about getting dental implants, there's a lot you need to know. Telling us all about implant dentistry, we're joined by Dr. Adam Still with Smile Sarasota. Yes, implants. How long have those been around, implants?
Well, the technology involved with placing implants has been around for 40 plus years probably, but it's becoming more and more mainstream as time goes on, and we're seeing it kind of the number one go-to option for missing teeth at this point.
Okay, so what are dental implants? And let's start with that. What are dental implants?
Well, when in a situation where someone loses a tooth for whatever reason, whether it be a decay, fracture, or gum disease, or whatever caused you to lose the tooth, a dental implant is an option where we're able to, once we take the tooth out, we place the implant, which you can think of as like a titanium screw that would go down into the bone, and that's going to replace the root of the tooth. Now, from that root, or that artificial root, we're able to basically anchor materials on top of that so we can restore the space with, like a crown, for example, that gives you a tooth back in that spot.
Now, why would you recommend an implant over some other procedure?
Well,
is that the last place to go, or how do you determine
not necessarily. There are other options that you can do besides an implant. One option, for example, would be to place a bridge. So let's say the tooth is lost. In order to do a bridge, you would prepare the tooth on each side, and then we would cement a bridge in. Think of it as almost like 3 crowns in a row that are linked together. They would cement over those abutments. And from that, you have a prosthetic tooth in the middle that fills in the space.
Okay.
Another option would be to have a removable appliance made, like a partial denture, for example, where it would be made of like denture, acrylic, and actual metal as well. And it would have little clips that would anchor to some of the remaining teeth, and there would be a tooth there that would fill in the space, and it would be removable by the patient.
Okay, so when would you recommend an implant to a patient?
Well, you'd use an implant in a case where you are looking to replace the missing space, you don't want a removable appliance, and you also don't want to involve the adjacent teeth.
Okay.
When you're doing a bridge, for example, you would prepare, again, like I say, the teeth on each side for a crown, which means you take the outer layer off around the tooth structure on each adjacent tooth. Okay. With an implant, we're able to be more conservative with tooth structure because we're not touching those teeth. We're just restoring the spot by itself.
Right.
It's also a huge advantage of someone who doesn't want something that's be able to take in and out of their mouth as well.
So those would be the alternatives: a bridge, or
something removable.
And then, like you said, you have to, now you're impacting 2 other very good teeth. There's nothing wrong with
exactly.
them. So that's where that would make sense to me. If
right.
you're only going to take, that 1 tooth and not impact 3. So
exactly.
I like that. Advantages, disadvantages to implants.
Well, as far as advantages go, it's some of what we just talked about, being,
Sure.
the conservation of tooth structure. Another thing I like about it is that it's cleansability. When we involve a bridge, we're connecting multiple teeth together, which makes it harder to clean around. Whereas with an implant, you can think of it as like a natural tooth at that point. You can brush and floss on each side. It's more of a natural feel to it. Another thing I like about implants is that it conserves the bone in that area. If we're taking a tooth out and we're placing either a removable appliance or we're placing a bridge over it, the bone around the extraction site will resorb down, and it'll end up you'll lose more jawbone in that area, in that spot. Whereas if an implant's placed in there, it'll actually retain the bone in that area.
Okay. So now we're talking about a small space, obviously.
Right.
So what else can be done with implants when you're working with these?
That's a good question. By no means is implant dentistry limited to just small spaces. It can be used in a myriad of applications. Some of my favorite ones are where we're replacing entire mouths of lost teeth, whether it be missing all of your upper and lower teeth, or maybe you're just missing your upper, or you're just missing your lower teeth. In those cases, if we place multiple implants, we can actually create prosthesis that will restore all of the teeth. One of my favorite things is when you have a patient who's had dentures for years, and they're using denture adhesive, and they're just so sick of using those kind of products.
Yeah.
If we place multiple implants, we're able to fabricate a denture that will actually clip into those implants implants, and it gives them retention from that. They still are able to take the appliance in and out, but it's kind of at their discretion, and it's more comfortable to them. Okay. Another option that's similar to that, but say you've got a denture patient that doesn't want to have it removable anymore, if we place multiple implants, in those cases, we can fabricate a much smaller version of a denture that will actually screw into the implants, and it stays in permanently, so the patient doesn't take it out anymore. They leave it in permanently, they're able to clean around it, and it's a little more comfortable to them, and it actually, you know, feels more natural because we can take away a lot of that acrylic material that they're used to having in there.
Okay. One final question before we close today. Time on these, because the other one you were saying it's, you know, you're in and out. Implants, I'm guessing, take a period of time.
Yeah, and that's maybe the one thing that's a drawback to certain patients is that there's more time involved with the process usually. When the tooth is taken out, typically we're going to graft bone in that area, we're going to let it heal for a few months, and then later on the implant will go in and be placed, and at that point we have to let the bone integrate around the implant, so a few more months of healing time. So there's a little longer treatment period, but the end result is usually great.
But the end result is great, and that's what you want, because you're going to have it forever.
Yeah, exactly.
Okay. Great. Thank you again. All very, very informative information here today.
Thank you very much.
We have more tips and advice for you with Dr. Jenny Wilkins of Age Vital Pharmacy right after the break. We'll be right back.